Hello, everyone. Today, we get the answers to your most pressing questions in relation to the coronavirus. Joining me to give you those answers are the Chief Medical Officer, Dr. John Lee, the Director of Hazard Management, Danielle Coleman, and Acting Deputy Governor, Mrs. Gloria McPhail-Nixon. Welcome to all of you for being here. Thank you for joining us to get the answers that people want to hear here in the Cayman Islands as it relates to the coronavirus. So Dr. Lee, let's start with you, if we can, just to kick things off. What's the current status here in the Cayman Islands in relation to coronavirus?
Good afternoon, Donna, and thank you for inviting me and us all. There's no current cases of the coronavirus, the disease COVID-19 in the Cayman Islands. Mm-hmm. We do know that it's in the Caribbean, which is clearly giving everybody cause for concern. There are there are 3 cases in St. Martin's and St. Bart's, and 1 case, as we all know, in the Dominican Republic.
Okay, so everyone seems to be panicking, or at least in a state of concern. How serious is a COVID-19 or the coronavirus?
I think probably the real cause that's giving people concern is the rate of spread of the condition. That's alarming. It's like something's marching towards you, and there is a certain inevitability about that. The number of cases overnight from countries that normally would have good health services like Germany and France, Italy, are climbing in the hundreds. So it's climbing at a rapid rate, and in Iran and in Korea, it's like in the 500s per day. So climbing at an alarming rate. So that does give us cause for concern. I really don't think there is going to be much time before the World Health Organization, the WHO, declares this to be a pandemic, because it is clearly an epidemic in many countries around the world. This means that everybody in the healthcare sector right across the world, Cayman is no different to any other country, are really ramping up everything they're doing with regards how to manage this condition. And I think actually the Cayman has been working on this consistently for the last few weeks, and hard for the last few weeks, and our efforts have already been commended by the Pan American Health Organization and Public Health England. So my hat's off to the teams for getting their acts in order, and we're working even harder at it now.
Okay. One of the things that we've done to prepare is open the NEOC. What are the advantages, Danny, to doing that?
And we've been working with the hazard management, been working with obviously the health sector for some time, and they've been doing a tremendous job. I mean, it really has been a lot of work going on for the last couple of weeks. Mm-hmm. But of course, with something of this magnitude, it's not just a health issue anymore, it's a multi-agency issue. So the National Emergency Operations Centre is critical to ensure that it's a coordinated hub. We're working together for the right reasons and making sure that everything's being looked after. You know, when you think about this being an issue, we live on an island. So there's issues with, obviously, border control. There's issues with shelter management. There's issues with food security. We want to make sure that we have, the correct resources on the island. So the National Emergency Operations Centre is a really good coordinating hub, and we have 17 emergency support teams that all bring their own expertise to the table. So there's about 50, 60 people in that room, and they're all bringing a lot of expertise to make sure it's a multi-agency approach.
Okay. Acting Deputy Governor Gloria McPhail-Nixon, the civil service, you're responsible for the civil service at this very point. How will you ensure the safety of civil servants here?
Well, the safety of the civil service is really paramount to us. We understand they are government's operational arm to be able to protect and serve the community at large. Mm-hmm. So keeping our staff safe is very important, and there have already been many actions that have been taken to ensure just that. If you start thinking about, for example, our ports of entry, public health have been working very closely with departments such as our CBC to make sure that the teams there know what practical steps that they can take that will be very effective in keeping them safe. Those are things like what we tell the public at large in terms of, general hygiene factors, making sure that you're washing your hands regularly, making sure that you have sort of hand sanitizers and those things that have been available to you, making sure that if you feel ill, you understand what protocols need to be taken for that. And we were also looking already at proactive steps that have been taken, for example, with the travel restrictions that have been adopted. So again, like our civil service and the population at large, we've taken proactive steps to try to reduce the likelihood and the speed at which the coronavirus would reach our shores. Beyond that, we're continuing to send out information across the organization about practical steps that can be taken. So we've talked about things and have adopted just yesterday, for example, measures which have suspended all non-essential official travel. So we know that the coronavirus has significant presence in places abroad. We have reduced and eliminated non-essential travel of the civil service. So both for our core civil service and the wider public service, as our business requirements, we are stepping down the need for people to travel for work unless it's absolutely essential, again, as a precautionary measure. So it's a dynamic situation, and we are looking at all of the phases that the islands may go through and what steps need to be put in place to be able to maintain safe staff and a healthy work environment. And support is already being provided in the form of policy frameworks that will help the civil service and people who manage other people to know what they should be doing when and if as we progress through the stages of our planning.
Okay, that leads me to the next question, which is about continuity of operations within the civil service. What about that?
So very fortunately, and we talked about standing up the NEOC, we have, living in the Caribbean, 6 months out of any given year, we're under the possible threat of a hurricane. So disaster preparations are a part of our DNA. It's a part of our regular business cycles. And business continuity is one of the standing committees that is responsible for helping the islands through that, and specifically ensuring the continuity of government services. The Continuity of Operations Subcommittee is already active, and generally we have been looking at sort of 3 areas of what's necessary for government to operate, specifically the people issues, the data issues, and the facility issues. In a pandemic threat, the main concern is for our people issues. And so there is already work that is taking place to, during this preparation phase, to do everything we can, as we've said, to keep our staff safe. That includes having on hand more supplies that are available for things like being able to use the sanitation wipes. Those have been dispensed throughout our building today. So coming off the elevators, you'll see things like that happening here. We're also looking at our ability to put in place flexible work arrangements. So for essential services that can be conducted remotely, we'll have the ability for staff who deliver those services to be able to have other work arrangements that, again, can ensure essential services are being carried out. And we are also adopting a flexible sick leave policy that, again, will reduce the likelihood that if someone were to become ill, that would spread across our organization. So we're going to have in place policies that would contain that issue, and even more importantly, not push greater stresses for what would otherwise be mild cases onto our health services authority, because people are doing things like being required to get sick notes in order to be out of the office. So we're thinking proactively, what if this were to happen? What policies would we amend within the civil service to allow essential services to continue to be delivered without creating other negative repercussions across the organization and the community?
Okay, let's set up a scenario here. I've traveled. I work with. I'm a civil servant, and I decide to isolate myself after traveling because I feel that I may have the coronavirus. Will I get in trouble with my head of department or chief officer because of that?
So thank you for that scenario. And in that scenario, the first thing that will happen as you come through the ports of entry, as you land at the airport, you're going to be met with public health officials, and they're going to be providing you information about these are the things to look out for and here's what to do. If you are coming back with a relevant travel history and you feel ill, then we absolutely encourage you to do just what you've recommended, to stay at home until you can the symptoms pass or you receive further information depending upon how ill you are feeling. So that is absolutely the right thing to do, and that is what we're encouraging our staff to do. The preemptive measure to look at reducing travel, we hope, will reduce the incidence of people having both travel history and feeling that they have symptoms that are possible for the coronavirus. Excuse me, the coronavirus. So, our first wave is to try to reduce the likelihood that you would have those dual factors at place. But if you have come back recently from traveling, then what you've just said is absolutely the responsible thing to do. And not only would you not get in trouble, it's exactly what your manager would encourage you to do.
Okay. Will I still be paid?
Absolutely. Absolutely.
I mean, it's an important question,
It is.
People want to know, particularly as it relates to the civil service.
So, as a caring employer, we take the welfare of our staff very seriously. And we also understand that it is necessary to provide the type of support that will allow and encourage people to do the responsible thing. So in this case, if you are presenting with those symptoms in a recent travel history, then staying at home is the correct thing to do. And we want to make sure that our policies are consistent with encouraging you to do that. So yes, in those instances, of course, staff would continue to be paid.
Can I just add to that, actually? Going back to the continuity of operations, I mean, every year we work very closely with Portfolio of the Civil Service to review and provide feedback for all the COOP plans for all government bodies. So we have about 96, I think, and that's including statutory authorities. We also get some private plans as well that we review. So that's an ongoing thing. Now, admittedly, a lot of those are sort of more focused on the hurricane type scenario, but there is a statutory requirement every year, a legal requirement every year under our law, that those are submitted to hazard management and POCs. And we also provide training, obviously, for civil servants and private entities on continuity of operations.
Right. Now, there's been, and I'm sure the public is aware of this, there's been a run on things like hand sanitizers and sprays and all that sort of stuff. But do we really need to have masks, the hand sanitizers, the soap? Are those things that we definitely need at this point?
That sounds like it might be for me. That's a sort of a yes and a no. So yes, you do need to keep your hands clean, but soap and water, which there's plentiful supplies on the island, will do absolutely fine. And if you come to a sink where there's just dish detergent, that'll do fine as well. Wash your hands frequently with soap and water, and if you don't have access, then use the hand sanitizer. This is particularly important if you're going into a new environment, especially if you're returning home and you've been out and you've been touching lots of things and you don't, So come home, wash your hands before you do anything else. I also wanted to mention the issue about keeping your distance as an important thing to try and protect, because this virus is particularly sensitive to the droplet spread. So keeping at least 3 foot, if not up to 6 foot, increasing your normal social distancing is a very important step to try and protect yourself. And that's going to feel a bit odd because it feels like you're being a bit rude, but we all need to try and practice now so that we can do it effectively.
Sure.
Clearly that's not possible at home.
Right.
Did I get your answer about the...
Yeah.
Oh, as far as the masks are concerned, sorry,
Right.
the masks.
Yes.
A surgical mask, which is the thing that many people are trying to get hold of, will only protect you for about 15 minutes until the mask becomes soaked. At that point, it's letting everything through that you think you're being protected on, so it's absolutely a false sense of security.
Right.
So my advice would be is rather than wear the mask, keep the distance, and that is your protection better than the mask.
Okay.
Masks may have a value in some certain instances, like if somebody has a cold, is an active cold, and may sneeze unexpectedly, may cough unexpectedly, and they need to present themselves to the doctor, or maybe they are walking through the airport, they may be asked to put a mask on in order to cut down any potential droplet spread at that point.
Okay.
But for most other circumstances, it's not recommended.
But the social distancing as well. I mean, we are looking at, and I think we need to encourage the public to look at events, social events, sporting events, church. When this does eventually get to our shores, and I'm sure it's going to be sooner as opposed to later, those kind of gatherings will not be encouraged at all, because at the end of the day, that's how spread happens very, very quickly. So we do encourage everyone to be considering whether those social events are absolutely critical for one, but again, in future, when it does happen, when it comes, it really shouldn't, those kind of gatherings should not be happening.
And considering the fact that we're a very touchy-feely type of society,
Yeah.
everybody wants to,
Yeah,
hi,
absolutely.
how are you?
Yeah.
Shaking their people's
Yeah.
hands.
May I add something?
Sure, absolutely.
So another issue is, it gives me concern that some people may feel that it might not affect them for one reason or another. But I think it's really important to realize it's affected all of us already. It's affected many people's travel plans, or already been impacted. They are changing their plans for the rest of the year, at least in the medium term. So it is going to affect us all, and it may not affect you. The individual person may actually be in a category where they think, well, I'm going to be okay. But if it affects your employer, if it affects your landlord, if it affects the person that fixes your utilities, all of these people impact your life. So we need to protect the whole of the society by everybody taking and using the same sensible advice that we're giving out.
So in light of everything that we've discussed already, is it safe if someone has a child to send their child to school?
At this point, definitely yes. Obviously, if there will be outbreaks in schools, and I think John will talk more about children can be asymptomatic, so they can be carrying without knowing. And of course, when they go back and see the rest of the family or grandparents or so forth, that can be a real issue for the more vulnerable groups. But yeah, at the stage, children's school is going ahead as planned. And if there is outbreaks in school, obviously we're working with the schools to make sure that they will be certain classes will be shut down, or the whole school if there's a big outbreak.
So what we need to bear in mind is that 90% of people in the community, probably a lot more than that, but that probably worst case is 90% of people will be either mildly affected or not affected at all. So we need to continue to do the business of the country and keep the country going in all of its different functions, and schools is one of those functions, because the parents of many of the kids will have jobs to do and places to go. The issue about children themselves, we don't really know, and this is where we really need to be driven by the science to give out answers. So when we don't know, we need to say we don't know and not have a vacuum filled with fake news.
Right.
But with the children, it's either that they can't get the virus, or that they have the virus and they don't show any symptoms, or they're not able to pass the virus on. I suspect they do have the virus, but they have relatively no or no symptoms at all. Because as with most viruses, schools are often a hotbed of not only kids but lots of adults coming together and mixed together. For that reason, I suspect that many schools, when they have a case, they will contact the Department of Public Health, that is the advice that we're giving, and describe what's happening and get the Public Health Department to say, should we close or should we not? We will err on the side of caution. If we think there is a suspect case, we're going to say, please close the school until we can investigate and to isolate and to get Public Health to trace the person who's thought to be infected and everybody around them, so we can make sure we can contain it as much as possible.
All right, well, we depend on imports in the Cayman Islands. Do we have enough supplies on island?
I mean, every year we talk about personal preparedness for everything. I sat here a month ago talking about having family plans in place for earthquakes, for any sudden onset event, any slow onset event. So every year we have surge capacity through the supermarkets in regards to food for the hurricane season.
Right.
Now, we are going to be working with them closely now to ensure that surge could perhaps come a bit earlier.
Yes.
But we are in touch with that. Under the National Emergency Operations Centre, we also have economic continuity. And so much of this is striking the right balance between protecting our tourism product and also, again, making sure that we can continue to function as a very good, economically strong society, strong community. So it's striking that balance. But yes, at the current state, we have lots of groceries and safe products, but it's making sure that we monitor that regularly. And if there's need for surge capacity, we'll obviously be doing that.
And not only in the food stores as well, but the Health Services Authority has already been increasing its stocks.
Yeah. Okay.
It has actually purchased additional ventilators and things in case we should need them, in case we have to rise and have to meet the surge, an increase in capacity. They're also as Danny's saying, in the other sectors, they're bringing forward their plans for hurricanes, as if hurricane season is starting earlier. So they're beginning to order more things to make sure their supply chains can, to make sure the supplies are increased in the island.
And again, this is all about the three islands together. It's not just Grand Cayman, obviously. We really have to think about the sister islands. So we'll be visiting them tomorrow to talk with the different, obviously the government, the schools, HSA, and the community to make sure that they're also, getting the surge capacity they need in the event of an outbreak.
Okay. So if a case is, let's say, confirmed on the island in one of the districts, is that district locked down? What happens? What happens?
To be honest, that we have not gone through all of the plans as yet, and that's part of the reason why we're activating it. That is one of the scenarios we're going to work towards and see whether it is feasible and how it will be done.
And under our legislation, we can do that.
Right.
Obviously, there's no point right now we want to ever consider invoking emergency powers at this stage, because we do have a lot of allowances in our own disaster preparedness and hazard management law that can actually do that, and also acquire buildings and so forth. So locking down a district, it would have to be a very extreme case, but we have a policy group and an executive, National Hazard Management Executive, to help making those decisions. So that would go through the whole. And we're working next week. We have a couple of tabletop exercises, both with the executive and a more multi-agency. So let's work through those kind of initiatives and what ifs to make sure we're ready for any eventuality.
Okay, so how about elderly people that may be living alone? How are they being advised? Because I mean, statistics show that this coronavirus is hitting or affecting our elderly more than anybody else.
I think throughout the whole of this issue up to now and going forward, we want to try to educate people as much as we can, and by trying to get the information to all of the different groups that need it, we may be able to help them to manage better. I mean, to that end, we feel that actually written material continues to be a really helpful way of sharing information, and we are working towards being able to do a leaflet drop to the more vulnerable people, the people who might not have internet access, so they can have some written material in order to help them. They will also, and within that material, there are also some help mechanisms which are more traditional, such as we wish to set up a hotline. It's nearly set up now, so that there'll be a flu hotline which is managed by the Health Services Authority, so that people, if they have concerns about their health, they feel they're developing something, or they just want to find out, they want more information of a fairly critical nature, a fairly urgent nature, they can use the hotline to find it out if they feel that their usual doctor pathways are not open to them for that at that particular time.
What about our elderly who may be in, let's say, the Golden Age home or the Pines or some group setting? What about those folks?
I mean, that's certainly different. And what's very useful is that now a lot of information is coming out from agencies such as Public Health England, and they have quite clear guidelines for a lot of different groups. And one of those groups is people living in institutions or in care homes. So there is information that we can provide for them if they don't find it themselves, and we can certainly point them to the right place.
And we're trying to make obviously all our messaging in a number of different formats, because again, door drops are great, English, Spanish, and so forth, making sure they're accessible to everyone, people with reading disabilities and so forth. A lot of social media, a lot of websites. So we're trying to get that information out in so many different ways, so everyone will be able to access it in one way or another.
Yeah. And I think it's really important to say that one of the advantages, you could say, that we have right now is that there are other countries who have already been through earlier stages of this, that we're able to learn from the example of what's worked and what hasn't been as effective. Right. And there's a plethora of information. We've talked about Public Health England and other places that allow us to easily and quickly adopt and adapt, so that we're able to put out reliable information that people can inform themselves, inform whether it's their business operations or their personal arrangements at home. It's really important that we rely upon trusted information, because the threat of a pandemic is really about the science, and we need to make sure that we are informing ourselves with things that are trusted and have been developed by people who are looking at this properly and can give us proper advice. So we really are grateful for this opportunity to be able to share what is happening within the civil service, what's happening in the medical community, what HMCI is doing to lead this effort on behalf of the Cayman Islands. And the key message and takeaway from members of the public is going to be there are reliable sources. The Cayman Islands government will continue to be putting out information, keeping the public abreast of what we are doing, and providing information about what members of the public themselves can do to as Danny said, to really avail themselves of their own personal preparedness plan.
Yes, I think one of the principal channels for the medical sort of advice that we're going to be used, just so that I can advise, is through the HSA. So we're trying to funnel the information to that site. The site has some information now about coronavirus and frequently asked questions, but that the information there is going to grow. So that's hsa.ky, and then you'll see a link there to go to coronavirus.
Okay, so tell us, who is most at risk? What groups of people are most at risk? And what if I happen to live with one of those people that's in that high-risk group?
Yeah.
Dr. Lee.
As with many illnesses, this virus appears to favor those people who have pre-existing illnesses. So cardiovascular disease, chronic respiratory disease, diabetes, cancer, those groups are the ones that appear to be more vulnerable to the effects of the virus. The elderly are also another group that are more susceptible, and the studies have shown that those are the groups that struggle harder with the virus. If you live with somebody like that, and many of us do, we all know people with many of those different conditions. We just need to be particularly attentive. They may come through with no problems, but if they're particularly susceptible, please call early. Either call the hotline or contact your healthcare professional for advice, or if you're worried, call 911 and seek assistance for especially for the vulnerable groups, because it is possible that they may. We all know that they may become sicker a little bit faster than some of us, people who are not in those groups.
Okay. Setting up another scenario. Suppose I feel that I've developed the symptoms, or I have the symptoms of coronavirus. Should I go to the hospital?
Please, no. It really depends on the severity of your symptoms. My answer, please, no, is for the majority of people, you will get through this condition having flu-like symptoms, and you'll be able to manage it at home.
Okay.
Because it may affect quite a large number of the population. It would really overwhelm either your local doctors or the hospitals if everybody was to attend. So what we're encouraging people to do is to take simple things to reduce your temperature, like paracetamol, Panadol, acetaminophen. That's one of the safest drugs we know to reduce your temperature if you have a temperature, or if you have sore throat and you're having a little bit of discomfort. And if you wish to get further advice, please have a look at the hsa.ky website and use the telephone hotline to get further clinical advice if you need. If you're struggling at all, yes, you should go and attend, whether it be to your local doctor or to the hospital. Often, if it's to your local doctor, you'll need to call ahead if you feel you're suffering with coronavirus in order to warn them, and hopefully there'll be some masks outside so that you can wear them. At the hospital itself and the GP clinics, you'll find masks outside before you present, and they're actually developing in a very short space of time. I suspect by next week it'll be up and running. A dedicated flu clinic, which is to the side of the A&E. If anybody knows where the current mental health unit is, that's where the flu clinic will be, to have a separate set of facilities to attend for that.
Okay, that sounds...
And can I just piggyback that? I mean, in mental health, we have incorporated mental health inside of our NEA's National Emergency Operations Centre, because it is a critical thing to be dealing with right now. Yes, everyone's quite terrified. It's really important that you're looking out for each other and nurturing each other, and be it your colleagues, be it your family, doing the things that actually help lower your stress levels.
Right.
Because, obviously it's a bit of a scare. We've just come off the back of the earthquake. People are still quite panicky about that. Mental health is a really, really big, important thing to be dealing with right now, and to be addressing and trying to, again, preempt further issues.
What may seem like a silly question, but as a pet owner, and I'm sure the pet owners out there will appreciate this, is there any link between human and pet transmission, animal transmission, as far as can my pet get coronavirus and can it be transmitted in either direction from human to pets?
I think, like many of the questions in this area, there are a lot of I don't knows or we're not sures.
Okay.
Certainly, this is a zoonotic disease, which means it is thought to have come from an animal, probably from an animal in the market in Wuhan, and then found its way into man there. But since it's got into man, it's clearly been very successful at transmitting itself. I read a report about an hour ago that there is a dog that has been detected with coronavirus. I think it was in China. I'd have to check the details.
Sure.
But the details of, a pet. The details of that I don't really know, but it looks like it might be possible.
Oh, okay. All right, so it's not a silly question after all.
No, it's not.
So-
And so much of this is uncharted territory anyway. So
Yes.
each day we'll be providing more information, and anything we learn, we'll be providing that and be very transparent with the public, obviously, on that.
I think
Okay.
the public has to sort of realize that this virus has the potential to be with us for a very long time. It hasn't shown itself to be burning out yet, unlike MERS and SARS, which did after quite stringent containment.
Right.
This is continuing to be successful. It is very possible that this could be with us for years to come, and that when you go and have your flu jab, you have your COVID jab, as you know, it's all mixed into the same injection. We need to be aware of that.
Okay, so just some final questions as we wrap up. Will antibiotics work?
I should just qualify what I just said, though. You don't yet have a vaccine.
we don't
for
have a
COVID.
No, we
vaccine.
don't. Exactly,
Sorry.
yes.
I didn't want to promulgate false hope.
Right, but will antibiotics work?
No. I mean, sometimes when you get a pneumonia, like a viral pneumonia like COVID can provide you, you can get a bacterial infection on top. But antibiotics only help for bacterial infections, and so they won't help here. And there's no other known treatment so far for this particular virus, although you've heard a lot of different combinations are being trialed elsewhere. Eventually, well, I don't mean eventually, in a relatively short period of time, I suspect we will know how better to treat it with medicines. I think that'll be coming, but it may be weeks or months away.
Okay. As it relates to civil servants, acting deputy governor, are civil servants being advised not to travel? I mean, I know you mentioned earlier about non-essential travel, but what about personal travel?
I mean, we think it's prudent to just, follow what we think is sort of common sense in these areas. We know, based on the travel restrictions that have been put in place and the information that is widely available, that there are some locations that have heavy concentrations of the coronavirus, and it would just not be wise to go there. So what we are saying to individuals is, if you do not have to go, our recommendation would be not to put yourself at risk of traveling to those places that have travel restrictions in place. Okay. The reasons for that are twofold. One is obviously because we want to reduce the likelihood of your being exposed to someone who is sick and yourself becoming sick. And the second is a more practical consideration. There have been a lot of reduction in travel and airlift, so you could end up going someplace that you have difficulty getting back home from. So we think it's just common sense to try to avoid those places. We're not saying that all travel is affected in the same way. We know that there are persons who, for personal reasons, will travel to places that either have no reports of the coronavirus or very low reports of the coronavirus. Again, and we would just say, follow the same hygiene factors we're talking about following here in the Cayman Islands, where we have no cases of the coronavirus, which is, keep your hands clean, keep proper social distance. If you encounter someone who is sneezing and so forth, we would say try to avoid that if at all possible. And if you begin to feel like you are experiencing some of the symptoms which are consistent with the symptoms for the coronavirus, then we would say that certainly you need to take measures to isolate yourself until such time as you can find out whether there's something that is more threatening that is there. But for just practical reasons, we're saying right now, our advice would be to certainly not go to places where there are high concentrations, and if you are traveling, to be sensible about it.
Okay, final threefold question for you, Dr. Lee. Do we have enough testing kits on island? If not, when will they arrive? Also, how accurate is that test, and how quickly can we expect for someone to get results back?
There seems to be a misnomer about this, because it's not so much a kit.
Okay.
By a kit, you think, it's like a pregnancy test or something. You put a drop on and then the result comes out.
Right.
It's not like that yet.
Okay.
For some something like influenza A or the influenzas, there are testing kits because that influenza has been around a long time. So somebody who's been tested on a cruise ship will have had a test, they would have had a drop of blood and we dropped it in and there's your answer. But at the moment, the only way that we have to test it is by what's a fancy chemical term, polymerase chain reaction, a PCR. And that machine, there are two different forms. There's one where there's a cartridge, like a coffee cartridge, you put in the different flavors, like you put in dengue or you put in COVID and so on, and out comes your result. You still need a big machine. There isn't one for COVID as yet for this coronavirus. And then lastly, there's the one that's more like a chemistry set. You still have a big machine, but you need to do mixing and stuff in a safe cabinet and so on in order for the result to come out. And that's the only way that we currently have to test. We don't have the ability to do that at the moment. We're sending our samples to CARFA, as we do for dengue, and they use their PCR machine in the chemistry lab type way to get the answer for us. So that takes about 5 to 7 days. We are working towards having, we do have PCR machines on island that are used for other purposes. We're working towards quickly trying to get them to the state that we can do our own testing, and I'm hopeful that might be fairly soon.
Okay, and I would think that the tests are accurate.
Yes.
Yes, they are. Okay.
This sort of test, yes.
Okay, any final words?
Again, I think from a hazard management perspective, and I say this about every hazard, it's just really important to be prepared as a family, have a plan in place, have your supplies in place. You don't need to go to Hurley's or Foster's or Kirkstay and go mad shopping, but you do need to have supplies in place for the whole family. If you got quarantined in the next few days or weeks, you have to stay in your house for 14 days, so you need to have entertainment, get books, get magazines, get things that the kids can play with, get food supplies that, tin supplies that can last. I think that's, again, this personal preparedness as a family is critical for any hazard.
Okay. Mrs. McPhail-Nixon?
I believe that, similarly, we across the civil service are looking at our departmental preparedness. So what is it that we're doing in preparations for if our workforce should become reduced because of the impact of the coronavirus. So we are, as I've said, looking at our flexible work arrangements. We're looking at our flexible sick leave. We're talking about different ways that key government services can continue to be delivered, even if it means that they're being delivered from other locations, or if it means that we're taking some of our staff who were delivering non-essential services and having them working on alongside others to deliver essential services. We're being really keen to make sure that we can do all the things that the community relies upon us being able to do as the civil service responsible for making lives better. So those plans are already being deployed.
Okay, Dr. Lee, any final words?
Catch it, bin it, kill it. Catch it, bin it, kill it.
All right. Okay, so I think that's a good way to end. Thank you to each of you for joining us. And of course, to the viewing public, we thank you for joining us today as well.